At the beginning of January, Alberta's provincial government fired the head of Alberta Health Services, a woman named Athana Mentzelopoulos, 1 year into her 4-year contract. Not only was she fired without board approval, something the government likely didn't have the authority to do, but the timing of her firing is deeply suspicious. Mentzelopoulos was just 2 days away from a meeting with the Auditor General, in which they were going to discuss an ongoing investigation that Alberta Health Services had undertaken into strange and potentially corrupt contracts that the Alberta government had entered into with healthcare providers over the past 5 years. Now, Mentzelopoulos has brought a wrongful dismissal suit against the provincial government that not only alleges that she was fired in order to muzzle her investigation, but that Danielle Smith and the UCP government have given inflated and ineffective contracts to companies with close ties to the government and Smith herself. If what Mentzelopoulos claims is true, it paints a picture of nearly 5 years of corrupt contracts, deliberately wasting taxpayer dollars to line the pockets of rich friends and associates with close personal connections to the Alberta government, and of a purposeful campaign by the Minister of Health and other members of the government to stop the investigation and seize control of the procurement process so that no one could stand in their way. A quick note, there are 2 agencies in Alberta, Alberta Health Services and Alberta Health. Alberta Health sets the policies and standards for the health system, while Alberta Health Services delivers those health services. Historically, Alberta Health Services has overseen the procurement process. I'll be referring to Alberta Health Services as AHS to avoid confusion. The events leading up to Mentzelopoulos' firing begin in June 2024, although as we see, they really go back much farther, maybe all the way back to 2020. To set the scene, Alberta has been working to privatize part of its healthcare for years. This was part of what Danielle Smith campaigned on as well. A big part of this is implementing more private clinics that are paid for by the government. Their services are still covered under provincial healthcare, but they're run by private organizations. One of these organizations in Alberta is the Alberta Surgical Group, or ASG. ASG came on the scene in 2020, lobbying the government aggressively. They opened a clinic in 2022 and signed a 2-year contract with the government. Back in 2022, there was a request for proposal out for chartered surgical facilities. ASG sent out a proposal but failed to win the process. Despite that, they were awarded that 2-year contract anyways, and not just that, but a contract that was above market value in comparison to other companies in the RFP process. We'll get to how that potentially happened later. Regardless of how, ASG's 2-year contract was up for renewal in 2024. Mentzelopoulos looked at the contract and found that ASG was expected to exceed the contract value by almost $3.5 million in billings, while also projected to not deliver the required number of surgical procedures under its contract with AHS. In June of 2024, Mentzelopoulos got a call from the then Chief of Staff, Marshall Smith, who asked her why AHS was capping the contract with ASG, which struck her as odd, both that Marshall Smith was asking her why she was attempting to rein in an inflated contract, but also that the Chief of Staff was advocating on behalf of a specific private surgical provider. At the end of that month, she sent an email to Alberta Health laying out the concerns I just mentioned and didn't get a response. She figured that meant that Alberta Health agreed. It didn't. The next month, Mentzelopoulos got a draft agreement from Alberta Health. That agreement would have removed AHS's ability to approve procurement contracts and transfer that ability to Alberta Health. Mentzelopoulos refused to sign the draft. That summer, Mentzelopoulos got another call from Marshall Smith, telling her that, quote, powerful people were angry and upset about one of her employees' Twitter feeds, one Nate Pike, who is an AHS paramedic. Pike was posting criticisms of the government while on duty. He also happens to run a podcast called The Breakdown, which, again, will come into play later. Mentzelopoulos asked if Smith was telling her to fire Pike. Smith said that Pike was her employee and that she would look bad, and there would be consequences. After further reviewing the current contract with ASG, Mentzelopoulos had serious reservations and felt AHS needed more information before continuing negotiations. She sent a letter to the Deputy Minister of Health basically asking for more information so they could renegotiate a new contract with ASG before it expired at the end of October. Other private surgical groups were advocating for contracts like ASG's since it had set a precedent, despite being overpriced and paying for services that weren't used. In order to responsibly steward public funds, the AHS board and Mentzelopoulos wanted to nip this in the bud. Just before Mentzelopoulos briefed the AHS board about all of this, she was taken aside by a board member who told her to be careful and cautious about her personal safety because of the people behind the scenes. Echoing that sentiment, Mentzelopoulos had another call with Marshall Smith in September, in which he wanted to know why negotiations were delayed. After she explained the reasoning, he told her that serious businessmen were unhappy with the delays, and that they were, quote, serious people, do not mess with them. Aware that Alberta Health wanted to get the contracts done quickly, Mentzelopoulos laid out recommendations on new pricing and regulated rates. Basically so that if everyone could agree on the price, they could breeze past some of the other operational concerns and get a contract done. Instead, Health Minister LaGrange delivered a directive to Mentzelopoulos indicating that all CSF contract negotiations, including the renewal for ASG, would now be taken over by Alberta Health. It laid out specific rates for chartered surgical facilities that were in excess of even the most recently negotiated AHS rates and would lead to significantly higher costs for AHS, aka taxpayers, and potentially hundreds of millions of dollars in profit for CSF owners. The person who had helped draft this October directive and who would be taking over negotiations on behalf of Alberta Health was a man named Jitendra Prasad. Now, who is Jitendra Prasad? To answer that, I have to tell you a few stories. Back in 2020, before Danielle Smith became Premier, AHS was looking for a supplier for PPE, primarily masks, gowns, and thermometers. They entered into a contract with the Marais Holding Company, a company run by Sam Marais, a prominent figure in the field of oil field training and underground utility construction in Alberta. The Marais Holding Company was an odd choice, considering that they had no track record or experience in providing any kind of healthcare equipment or services. The government paid $228 million for the PPE, but the quality was so bad it made national news. The masks had a range of problems. They didn't seal properly, making them essentially useless. They had a strange odor that caused headaches, and they gave healthcare workers rashes. The Marais Holding Company, eventually renamed MH Care in this context, got the masks from Vanch, a company based in China. Health Minister at the time, Tyler Shandro, basically said the complaints of healthcare workers were ridiculous and said this was an example of politicizing COVID-19. Yet dozens of physicians signed a letter to Tyler Shandro expressing concerns about the masks, despite the province repeatedly saying they were perfectly safe and up to standards. There has been some reporting that AHS overpaid for these masks as well, although it hasn't been verified. So the government likely overpaid for masks that didn't work. Not a good outcome, but it certainly wouldn't be the only time a government made bad procurement decisions during the pandemic. Surely the government learned their lesson. Well, 2 years later, in 2022, a combination of COVID, a spike in RSV, and an early start to the flu season caused a huge demand for children's acetaminophen and ibuprofen, basically Tylenol and Advil. Parents hoarded the medication, resulting in shortages across Canada heading into the fall. From September to November of 2022, Health Canada partnered with brand name producers in the US and Australia, ramped up domestic production, and worked with some other global manufacturers to adapt their product to the Canadian market. It became fairly obvious by November that this large increase of imports and domestic production would end the shortage, either by the end of that year or early into the new year. Despite that, on December 6th, 2022, Danielle Smith and Health Minister Jason Copping announced that they had signed a deal with a Turkish company called Atabey to import 5 million bottles of children's acetaminophen and ibuprofen at a cost of around $70 million. There are a few things here. First, Alberta only had 700,000 children under 12 at the time. Normal demand of this medication is about $400,000 per year across the country. So Alberta planned to import over 10 times the bottles used by the entire country in a year to address a shortage that was already ending. But Alberta had a plan for that, simply sell the excess bottles to other provinces who needed them. Which probably would have worked eventually, except that it didn't. At all. The dosage of the Turkish medicine was different than the North American dosage, which is a safety concern. They had also never supplied medicine to Canada before, meaning their packaging, warnings, dosing devices, labels, and more didn't meet Canadian regulations. Taxpayers had to pay for new packaging and labeling. When the first shipment did finally arrive in January, it was distributed to hospitals, where nurses could handle the different dosing requirements. I'll remind you the shortage was not in hospitals, but specifically in pharmacies for over-the-counter medication. It wasn't until March that medication arrived to pharmacies, months after the shortage was over, and at that point the medicine had to go behind pharmacists' shelves, since pharmacists had to teach parents how to do the different dosing. Because of these issues, Alberta could only import the medicine under a special exemption, aka the shortage. Due to delays, Alberta only managed to import 1.5 million bottles, since the exemption ended before they could import the rest. But even with that smaller surplus, they couldn't sell them to other provinces, who had already restocked their own shelves with brand name products that Canadians were used to buying. And finally, Alberta ended up paying about $14 a bottle, well over the wholesale price, meaning that even if they could have sold the medicine to other provinces, it would have been at a loss, subsidized by Alberta taxpayers. Health Minister Adriana LaGrange dumped the medicine onto Alberta hospitals who never had a shortage in the first place. Hospitals, for the most part, didn't use this medication since it was found to have potentially fatal complications in very young children. In the end, less than 5,000 bottles made it to public pharmacies, and only around 9,000 were used by hospitals. Alberta ended up paying around $6,000 per bottle used. But the $70 million that Alberta Health paid for this largely unusable medicine didn't go straight to Atabay. It went through a middleman, MHCare, the same company that facilitated the deal for the faulty PPE. As part of Mentzelopoulos' investigation, as evidenced in her lawsuit, she discovered that despite only getting 1.5 million units, the government paid the $70 million up front, and that, quote, the AHS had been directed by the then Minister of Health to make the purchase against the recommendation that AHS had specifically provided to the Minister of Health, which was in turn provided to the Premier's office. I tell you all that to tell you this. In November of 2022, Jitendra Prasad was working in procurement at AHS. At that same time, Prasad had an email address with MHCare, just before the Minister of Health entered into the $70 million contract for the Tylenol deal. Alberta Health had told Mentzelopoulos that Prasad was the person who negotiated that deal and knew everything about it. In early 2024, Marshall Smith installed Jitendra Prasad in Alberta Health, putting him in a position of influence over contracting and procurement. Prasad was supposed to work closely with Mentzelopoulos to, quote, get contracting right, while clearly under the influence and directive of the Premier's office. And now, Prasad was in charge of negotiating new contracts for Alberta Health, after they stripped the power away from AHS, who was simply trying to responsibly use taxpayer funds and avoid bloated and nonsensical contracts. Mentzelopoulos learned that AHS had purchased approximately $614 million in supplies and services from MHCare or other companies affiliated with Sam Maraish. She began an external forensic audit in November 2024 on contracts between AHS and MHCare. So how did Sam Maraish end up with so much influence over the government? And what does he or his companies have to do with chartered surgical facilities? In 2024, Danielle Smith went through a minor scandal when she was gifted tickets to a skybox at an Edmonton Oilers playoff game by Sam Jaber, a board member of Invest Alberta. Invest Alberta is a Crown Corporation and lobbying organization. Members of the board are appointed by the Alberta Government, meaning that Smith getting a gift from a member of Invest Alberta already seems like a big conflict of interest. Regardless, Smith shared that skybox with Sam Maraish and a number of other people. Sam Jaber works primarily as an accountant, and his firm registered 4 of Maraish's numbered corporations, not to mention that one of Jaber's ex-employees worked as a senior accountant for MHCare. Reporting from The Breakdown, a political podcast in Alberta, alleges they discovered a connection between Sam Maraish and individuals seeking the advancement of private healthcare in Alberta. They claim the corporations registered by Sam Jaber for Sam Maraish also include one of the founders of Alberta Surgical Group and 2 practicing anesthesiologists in Edmonton. These claims have not been validated by mainstream media, but The Breakdown and its host Nate Pike have been sued by Sam Maraish, resulting just recently in The Breakdown being silenced by a court injunction. You may remember Nate Pike was the AHS employee that Marshall Smith not so subtly asked Mentzelopoulos to fire because he was criticizing the government. Maraish himself has gifted hockey tickets to several government officials, including Utilities Minister Nathan Neudorf and Nate Horner, the Minister of Finance. That last name, Nate Horner, is important. We asked a while ago, how did Alberta Surgical Group get a contract with AHS despite being unsuccessful in the request for proposal process? Well, Alberta Surgical Group employs a firm called P3 Capital Partners as a lobbying group. OP3 is chaired by Doug Horner, the former Minister of Finance and cousin of Nate Horner. There's one more partner on those four numbered corporations, a man named Blaine Iskew. Iskew was formerly involved in strategic and clinical contracting for AHS, up until right around when MHCare was contracted to provide medicine from Turkey. At that point, Iskew left AHS and took a position at MHCare as a strategic business consultant. In her lawsuit, Mentzelopoulos mentions another unnamed AHS employee who left AHS for MHCare. Although he's not named in the lawsuit and it hasn't been confirmed, I don't think it's unreasonable to assume that could be Iskew. So we now have an idea of how this complicated web is connected, and why Alberta Health may be so adamant about taking over the procurement process, so they can force through contracts to their friends without having to worry about people like Mentzelopoulos fussing over things like wasting taxpayer money or paying for services they aren't using. By December, Mentzelopoulos was hearing rumors her job was in jeopardy because of her investigation. On December 11th, she met with the Deputy Minister of Health and said contract negotiations could continue immediately, as long as CSF negotiations followed proper procurement guidelines. The next day, Health Minister LaGrange dismissed the idea of Mentzelopoulos continuing her investigation and told her to get the contract signed by next week, which would bypass the correct due diligence. Mentzelopoulos essentially laid out her concerns to the Health Minister on December 13th, issues they should have both found alarming. She provided a letter to Alberta Health that could be sent to various CSF clinics who were in negotiations, stating that AHS wanted to continue negotiations but needed some information about shareholders, whether specified businesses were legal entities, and other similar crucial information. On the 19th, Alberta Health met with the Premier's office about the letter. They told Mentzelopoulos later that day that the letter was not approved and Alberta Health would review the matter internally to decide on next steps. The final nail in Mentzelopoulos' coffin likely came on December 20th, when AHS sent a letter directly to MHCare about the $70 million Tylenol deal, asking whether MHCare had met its obligations under the agreement and for a detailed status update, as well as details on the affiliation between at least one former AHS employee and MHCare. 3 days later, Mentzelopoulos was told by Alberta Health to end her investigation and send all files to Alberta Health. It also advised that Alberta Health would take over all due diligence for CSF procurements, telling AHS to stop doing due diligence immediately. On January 7th, LaGrange met with the AHS board to demand they fire Mentzelopoulos, but the board refused. The next day, Deputy Health Minister Tremblay fired Mentzelopoulos over Zoom, something he had no authority to do without board approval. Tremblay became the new interim president and CEO of AHS. A few weeks later, LaGrange fired the entire AHS board, making Tremblay also the official administrator of AHS. The takeover was complete. Since then, the government has tried to discredit and blame Mentzelopoulos in a variety of ways. Danielle Smith implied the lawsuit was a cash grab and that it was part of AHS's plot to obstruct Smith's vision for healthcare in Alberta. LaGrange's spokesperson said that the government had been requesting information from Mentzelopoulos for 8 months, but that she never supplied it, which is why LaGrange demanded it in December, despite Mentzelopoulos having provided consistent updates and been brushed off repeatedly. Between the long history of sketchy deals with MHCare and what is clearly the deliberate muzzling and discrediting of Mentzelopoulos, who tried to investigate these and other wasteful deals carried out by the Alberta government, there is a clear picture of corruption, of funneling taxpayer money into the pockets of rich friends and individuals, and attempting to silence whoever calls it out, whether it's an independent journalist or the CEO of AHS. But the mountain of evidence that has been and will continue to be uncovered may be too much for the UCP to cover up this time. While calls go out for Health Minister LaGrange and Premier Smith to resign, the question that will be answered in the aftermath of this scandal is whether healthcare is for the citizens of Alberta or as a way of printing money for the well-connected.